Okay, welcome everybody. And for those of you out there, I'm presenting for Cady Wellness Institute. I'm Dr. Cady. I'm speaking really loud for out there. You need to be here or you're going to miss something really cool. All right. So, quick story. In August of this year, I went back to Rochester, Minnesota to revisit Mayo Clinic, where I trained. The father, Daddy Mayo, William Worrell Mayo, came to Rochester and ended up building a hospital with the Daughters of Charity after a terrible tornado came through Rochester. He had two sons, William Worrell Mayo and Charles Mayo. And if you're a good Mayo son or daughter and you've trained there, sometimes it's useful to reflect on what the Mayos had to say. So let me tell you what they had to say and why it's reasonable and topical to share with you today. Dr. Charles Mayo, Dr. Charlie as he was known, said, there are two objects of medical education: to heal the sick and to advance the science. And Dr. Will said, the glory of medicine is that it is always moving forward and there's always more to learn. So I'm pleased to be here as a gold sponsor for this Holistic Expo. I was here last year. It was great. I loved it. There's all kinds of holistic goodness out there. I urge everybody here to visit every booth and every exhibit and talk to people. But the reason I'm here is that in 1993, I arrived in Evansville, Indiana, newly minted psychiatrist from Mayo Clinic. And I moved here to Evansville, and I thought I was ready for life. I thought I was ready to treat everybody. And for a year or two, things went really well. I could sling Prozac and Haldol with the best of them. You know, take 2 Prozac, don't call me in the morning. Yeah, I had that down. But what I found is that some of my patients did not get all the way better. Let me share a couple of terms with you from psychiatry: remission and response. If you have a person with depression and they respond to your treatment, that means they're better. Woohoo. If they are in remission, that means they are total happy campers back the way they used to be. I wanted to get my patients into remission. And I found that some of them I could not get into remission, even using state-of-the-art psychopharmacology at the time. So what did I do? Well, I studied more psychopharmacology. And I got a little bit better at it, but I still couldn't get everybody well, in remission. So I began looking for other things. And along the way, as luck would have it, I chanced upon a naturopath, Dr. Whitney Gabbard. Some of you may have heard of her. Some of you may have even seen her in the past. An amazing woman. And Whitney and I began to work together. And she was all about hormones. I was all about conventional medicine. And as she told me one time, my ND needs your MD. So she knew what she wanted patients to be on medicine-wise, but she couldn't prescribe it because she was a naturopath. And naturopaths cannot be independently licensed in Indiana. So we began working together, and it was really a great relationship. As both of us frequently remarked, we'd been together longer than I've been married. So it was a really good partnership. And I began to see what hormones could do. And then I began to get more training in hormones. And then I began teaching hormones. So for the last 8 years down in Texas, 3 out of 4 times a year, I teach a course in hormone replacement therapy for physicians and nurse practitioners and PAs down in Texas. And one time a year, I'll teach it somewhere else in the country. It's going to be it's going to be San Antonio in December. Looking forward to that and some good Mexican food. Anyway, I found that some of my patients, when they came to see me and they said, my thyroid is fine, and my doctor checked my thyroid, I found out, yes, the doctor did check their thyroid. The doctor checked their TSH, their thyroid stimulating hormone, which is, can I be frank with you all? Is it okay if we talk turkey? It's dumb. Let me tell you what the thyroid stimulating hormone is. And by the way, it is by the book, allopathic, monkey see, monkey do, medical practice. It is published in the LabCorp Guide to How You Work Up Low Thyroid and the American Academy of Clinical Endocrinology. This is their gold standard. You check TSH and you treat with T4. That's it. Now, last time we were here, I had total body immersion and kinesthetic learning. So we're going to do that today. I had training in neuro-linguistic programming. I'm a master practitioner. Don't worry, I'm not going to screw with your head. But there are different ways that people learn. There's auditory learning. I'm talking, you're listening. That's auditory. There's visual learning. But there's really nothing visual today except this beautiful background. I'm not showing PowerPoint. You can't do it that way. There's auditory digital. You can't do it that way because you don't have things in front of you. And there's kinesthetic. Kinesthetic is the way kids learn on the playground. So, is it okay if we have some kinesthetic learning? Is that all right? Great. Everybody stand up. Now, this isn't going to be like the hokey pokey. I'm just going to ask you to indicate. So, the TSH comes from your pituitary gland at the base of your brain. Can everybody point to the brain? Right here. Point like right in the middle. In the middle. That's the pituitary. The pituitary secretes thyroid stimulating hormone. Okay? Are you satisfied? Is that all you want to know? Does the TSH do anything in the body? Yes, it does. It stimulates your thyroid. Point of the thyroid. This is T4. This is where your thyroid hormone comes out. Okay? Are you satisfied yet? No. Oh, I hear some no's. We have some refined knowledge here. Okay. Does thyroid hormone T4 bind to thyroid hormone receptors? No. T4 has to go to the liver. Point to the liver. This is where your liver is. Right side. Right side. Okay. This is where T4 is converted to T3. Okay. T3 binds to your thyroid hormone receptors. Are we done yet? No. Who said no? What do we still need to know? You don't know, but you think there's probably something else, right? Okay. Oh, okay, hang on a second. Audience participation. Here you go. Thank you. I'm throwing out boxes of vitamin supplements. Those are about $80 a box. So thank you for participating. No, that's not it yet. So you got the liver. The liver makes T3 from T4, right? Okay. And then this goes and binds to receptors all over your body. That should be the end of the story. But do you remember that in eons past, we ambled across the plains looking for food? Meat on the hoof, berries, plants. Do you realize that it was sometimes a week before people would eat? They'd gorge on a good meal, kill some, meat on the hoof, barbecue it on the campfire, dance around, and then they'd be without food for a couple of weeks. So what had to happen? Well, there is a mechanism in the body. Have y'all, by the way, noticed that when you miss a meal, you get a little stressed? How many of you noticed that? Get hungry? Okay. So you got cortisol here on top of your kidneys. This is the adrenal glands on top of the kidneys. Point to your adrenal glands right here. Okay. The adrenal glands release cortisol, and they take the T4, and instead of going to T3, it goes to reverse T3. Reverse T3. Reverse T3 is the evil twin of T3, and it will bind to that thyroid receptor and block T3 from getting there. So, what's here? Pituitary, which secretes TSH, which goes down to the, which secretes T4, which goes to the, which makes what? T3, and what back here can interfere with T3? Reverse T3. Very good. Now you know more than most endocrinologists practicing. You can have a seat. Hope this doesn't fall off my head. There is a problem in just checking the TSH. So again, reflecting back to 1993 when I first started practicing, I would ask my patients with depression, because I was taught at Mayo, you have to exclude hypothyroidism as a cause for depression. So I would say, is your thyroid okay? Have you had your labs checked? Oh yes, my doctor checked my thyroid, it's okay. And inevitably, I found out when I started asking to see the numbers and the lab, all I got was TSH. Do you think now, after doing this exercise, that you can intuit the entire thyroid axis and what's going on in your body with the TSH? No. It is like asking, how fast am I going down the highway by how hard I'm pushing on the accelerator? That'd be a pretty lousy way to do it, don't you think? And Smokey sitting on the side of the road with a radar gun, and you're trying to see how fast you're going by how hard you're pushing on the accelerator. Maybe you've got an easy throttle. Maybe you can push it down to the floor with ease. You're gonna be speeding, or maybe it's a very stubborn pedal, and you got to really push. You cannot determine how you're doing with the thyroid only by how hard you're pushing on the gas. Does that make sense to everybody? Okay, so if you've been told all your labs are okay, or your thyroid is fine, but you feel sluggish, you feel depressed, that's how a lot of these people started coming to me. You have no energy, you have no mental clarity, and all you've gotten is a measly little tacky TSH, you have not been worked up. Medical practice, evidence-based medicine, as they call it, practice guidelines say check the TSH and treat with T4. Okay, so we talked about TSH. Let me tell you about T4. Synthroid is the brand name. Levothyroxine is the generic name. Oh, by the way, please don't anybody go out after this. This is an educational program. This is not medical advice. Don't go out and meddle with your medication before you talk to your doctor. And hopefully your doctor will be responsive, or your healthcare practitioner. Check the TSH and treat with T4. Okay, let's think about that. What's this? What comes from the thyroid gland? T4. Okay, T4 goes down here. Okay, what happens if you're really under stress? You make more reverse T3. Consequently, you can actually be made worse on thyroid medication. You can take Synthroid or levothyroxine, and you can be worse because now your body is pumping out more of the antidote to your free T3. So, something else. If you haven't been by our booth, please come by. We have these books to give out. Clear conflict of interest statement. These books were written by Gary Donovitz, this guy who founded a company called BioT. It's all about pellets. I don't care if I put a pellet in your backside or not. I want you to know about hormones. So in this book, there's an entire chapter on thyroid. You should probably read it. Their bias is not regular thyroid, but NP thyroid, which gives you T4 and T3. But before I continue, I wanted to share something with you. So our tagline at Cady Wellness Institute is integrating mind and body for peak performance. What does that mean? If you're depressed, I want to know why. I want to know if it's something in your body that's causing it. There was this dude called Descartes. Rene Descartes. Yes, he came up with this so-called Cartesian plane, the XY graph that has terrorized hundreds of years of math students. But he said that basically the head's up here, the body's down here, and the body doesn't affect the mind doesn't affect the body. Which is, yeah, I heard bull over there. Yeah, exactly. So I like to take care of the entire being. I like to integrate the mind and the body for peak performance. So if you have your thyroid out or your hormones out, and you have been through antidepressant after antidepressant after antidepressant, and you're still depressed, and your primary care doctor, this is how I started to get hormone patients. Your primary care doc says, I can't figure out why you're still depressed. You've been on 3 perfectly good antidepressants. I'm going to send you to the shrink. And then you come through my doors as an advertised antidepressant failure. I want to work you up from the ground up. So this book is largely, in fact, this one is exclusively for women. So I would like to do something that I did not do last year. I would like to tell you a story. May I have your permission to tell you a little story? Okay. So, once upon a time, there were 2 identical twin sisters, Carol and Ann. At 35 years of age, they began to have some symptoms. A little bit depressed, a little bit fatigued. A few years later, some hot flashes. And so Carol went the conventional medical route. And this is on page 66, and we will give you this book if you go by our booth. Okay? Everybody got that? Okay. So after a quick consultation, Carol's practitioner prescribed an antidepressant to address 2 of her chief complaints, depression and sleep problems. Even though this class of drugs has been shown to decrease sex drive and cause weight gain, which is true. 5 years later, at age 40, Carol returned to her practitioner. Now addicted to antidepressants, she had become increasingly overweight and still had no sex drive and no energy. Concerned about the extra pounds, she asked for help and was prescribed a diet pill. These days it would be GLP-1s. She was worried about her increasing anxiety as well, so her doctor prescribed an anti-anxiety medicine and a sleeping pill for her sleep disturbances. At age 45, Carol returned to her practitioner, still depressed and overweight. He noticed that her cholesterol was up. Rather than counseling her about lifestyle changes and examining her polypharmacy, multiple drugs, he put her on a cholesterol-lowering drug called a statin, which has been shown to cause liver issues and muscle tissue breakdown. The fatigue and muscle pain discouraged her from pursuing an exercise routine, adding more pounds, which increased her depression. Carol's exam at 50 years old fared no better. She complained of no menstrual cycle, hot flashes, and night sweats. Guess what happened? She was put on an oral synthetic hormone pill, not bioidentical, which has been shown in studies to increase risk of blood clots, heart attack, strokes, and breast cancer. Her hot flashes were likely gone now, but she still had no sex drive or energy and was still overweight. At 55, Carol told her practitioner she had quit taking oral hormones because she didn't like them. She was miserable, and on top of all of her other symptoms, she thought she was getting early Alzheimer's disease because she had memory problems. Okay, I heard statin. You get a audience participation. Okay, here you go. Statin. Statins lower coenzyme Q10. You have to have coenzyme Q10 for energy and for your brain to work well. Oh, and by the way, low estradiol, because estradiol in the female brain and the male brain functions as a monoamine oxidase inhibitor, which your doctor probably doesn't know, nor your nurse practitioner, nor your PA. And monoamine oxidase inhibitors stop the breakdown of your happy neurochemicals. Your pay attention, focus, be happy, be content neurochemicals. You have to have estrogen in the brain. This is the reason why women, when they hit menopause, think that they're losing their minds. Some women, I'm not saying all women, but some women feel like they're losing it. Like poor Carol. Now she's concerned she's got Alzheimer's disease. Her estrogen has tanked. According to her bone density scan, she now has bone loss, and she was placed on a drug for bone building, which caused her severe nausea and chest pain. Her blood pressure was now high. She developed type 2 diabetes and was placed on 2 additional medications. By the time Carol turned 60, because her doctor didn't understand how important hormone balance was to improving her mood, mental clarity, anxiety, bone building, heart health, diabetes prevention, weight control, breast cancer protection, and Alzheimer's disease prevention, she was tied to a lifelong ball and chain of medications that merely acted as a Band-Aid masking her symptoms. You get the gist? This is Carol. Okay, want to know what happened to her twin sister, Ann? Yeah, Ann went to see somebody like me, got put on bioidentical hormones, and lived happily ever after. So, integrating mind and body for peak performance. That's what we do. And so, if you're a woman, I want you to have this book. And if you're a woman with a male partner, or if you're a dude, there's another book called Testosterone Matters More, also on our table. I want you to get that. The last chapter of that is for your male partner. It's all about testosterone. So let me talk about these hormones. Any questions so far? Yes.
They say that you should have a balance of, if you're taking replacement bioidentical, that you should have a balance of estrogen and progesterone?
Yes, they say that you should have a balance of estrogen and progesterone. Yes. For you. Oh, while I'm handing these out, let me tell you, this is some good stuff. There's a high potency vitamin D. If you're on vitamin D, don't take it. Take that. If you're on a multivitamin, multi-supplement, don't take that. And if you're on fish oil, don't take that, because this will replace it. Okay? But it's about a month's worth. All right. Yes, a balance between estrogen and progesterone. So let me talk about these hormones. You know, there's that childhood, that I read this when I was a child. How do I love thee? Let me count the ways. Elizabeth Barrett Browning, I think. You all know that one? So these hormones, how do I love them? Let me count the ways. So I'm gonna talk about the hormones in women. Actually, I'm gonna talk about the hormones in both. So in both men and women, you need good thyroid balance, okay? TSH ain't gonna cut it. You need good thyroid. You need good testosterone. Testosterone in both men and women supports energy, libido, muscle preservation, bone mass preservation. It's why Ann, the twin sister, did so well, and why Carol ended up on the bone supplements. Mental clarity, and in both men and women's bodies, it is also converted, some of it, into estrogen. And both men and women need the estrogen. Estrogen in both men and women helps with brain clarity and focus and bone preservation. So for the two dudes here, yes, you need estrogen too. You can go tell your wife or significant other, hey, I learned I got to have estrogen too. I'm not suggesting you go on estrogen therapy. If you got testosterone, you'll have enough estrogen. In women, there is a progesterone estrogen balance. I will tell you, if you pick up this book, there are two deficiencies in it. Number one, it doesn't talk about reverse T3. And number two, it really doesn't talk about the totality of the need for progesterone. So you may have heard that women who don't have a uterus don't need progesterone. Have you heard that? If you're on HRT, you don't need progesterone. Okay, I have a question for you. Do you have breasts? So if you have breasts, those need protection too. The reason why the focus on the uterus is if you don't have a uterus and you go on estrogen, you won't bleed. That's true. Progesterone will stop that, by the way, but you still have breasts. So you need the progesterone to offset the stimulatory effect of estrogen. While I'm on it, how many of you have heard of the Women's Health Initiative and the idea that estrogen causes breast cancer? Show of hands. 1, 2, hold them up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. How many of you have heard that estrogen does not cause breast cancer? 1, 2, 3, 4. Okay, great. 5. All right, 21 to 5. 4 times. So let me tell you what the study really showed. This is the notorious Women's Health Initiative study. I'm checking my time because I want to make sure I can meet your needs here. The Women's Health Initiative study was begun supposedly with the most ethical goal. And it went like this. Say, we've noticed that women that go on hormone replacement therapy at the time of menopause do great in life. They have lots of energy, glowing skin, everything works down there like it's supposed to. They hang on to their bones, their cardiovascular system is protected. This is great. Gee, what would happen if we took women 10 years after menopause that have never been on hormones and put them on hormones? That was the basis of the study. So guess what the women were put on? A progestin. Okay, you know the name of it? You can't get another box. Provera, medroxyprogesterone acetate. It is a fake progesterone, okay? Who knows what estrogen they were put on? That's so close. No, unfortunately, they were not put on estradiol. That's bioidentical. It started with a Premarin. Yeah, pregnant mare urine. Here you go. There we go. Premarin, which stood for pregnant mare urine. So these female horses were impregnated. They stood in stalls with a catheter up their urethra, and they were literally horse estrogen manufacturing factories. And that's where the Premarin came from. Bad karma, for one thing. Okay, so Premarin, Provera. So if you had a uterus, you went on Prempro. If you didn't have a uterus, you went on Premarin. It was started 10 years after menopause. So here's what the studies actually showed. If you were on Provera, it increased your risk of breast cancer 8 times. If you were on the horse pea estrogen, it did not increase your risk of breast cancer. It did not. The breast cancer signal was from the fake progesterone, Provera. However, it did increase your risk of heart attacks and strokes and blood clots. Now, this is, as we say, one of those good news, bad news situations. So the bad news is, hey, some of you are going to get or would get a heart attack or a stroke or a blood clot. The good news is, if that didn't take you out after about 4 or 5 years, then hey, your risk of heart disease actually went down relative to the placebo group, but you had to survive to get to that point. So what this study basically showed is don't give fake progesterone to women under any circumstances, and don't give oral estrogen to women 10 years after menopause. That's what it showed. But what was reported is hormones are dangerous. They will give women heart attacks, strokes, blood clots. Oh, and they said in Alzheimer's or dementia. They called it dementia. and cancer, breast cancer. That's what was published. And therefore, hormones, the common practice was hormones should be used at the lowest possible dose for the shortest period of time, and you should get the woman off of hormones as soon as you can. That was the impact of the Women's Health Initiative. As a result, because women were deprived of estrogen, because their ovaries aren't making it after menopause, there were hundreds of thousands of women that died because of it. Because without estrogen, your bones are going to basically rot. You're going to get osteopenia, osteoporosis. And then what commonly happens is, it's not that you fall and break your hip, it's you break your hip and then you fall. You step off the curb, and because your bones have gotten so osteoporotic, you snap the femoral neck of your leg bone and you go to ground. And then what happens after that is you have to have a hip surgery, and then you end up on the medical unit, and then it's very painful to get up and walk, and then you're lying in bed, and when you lie in bed, you have a tendency to get pneumonia, and then you get pneumonia, and if you're an old person, you get pneumonia and die. You die. The end. That's why it kills so many women. So, in terms of integrating mind and body for peak performance, I want to know what people's hormones are. And there are many different ways that we can put hormones in somebody. Dr. Gabhart was fond of the troches or the troche. We've got creams. Many men have heard of shots. I've talked to some men about that today. And then there are pellets. What is not known is that there are ways to get testosterone up in men without the testosterone shots and not make them dependent on testosterone, because we can resuscitate their testicular function. But with women, I can't resuscitate ovarian function. If your ovaries have retired, you're going to need estrogen support and progesterone support. Okay, so that's hormones so far. Now, some of you that have been by have seen some of our BTL stuff. The Emsella, which is a chair that you sit on, and it zaps magnetic pulses through the pelvic floor in women to treat stress urinary incontinence. Where women, I didn't know this until recently, but I learned that women who have had babies and they leak when they cough, sometimes they'll cross their legs like that if they're going to cough. Did you know that? Yeah, women. Yes, exactly. So you can keep doing that the rest of your life, or you can do like Kegels until the cows come home, or you can get surgery, or you can come sit on our Emsella chair. It takes 6 treatments to radically change stress urinary incontinence, and we have a testimonial on our website, on our YouTube channel. So if you go by the booth, sign up for the newsletter, scan the little Linktree QR code, and you can go to our YouTube channel. If you want to know where it is right now, I'll tell you, it's easy to remember. CWIYouTube.com. CWI, Cady Wellness Institute, YouTube, YOUTUBE.com. Don't go to YouTube, you won't find it. CWI YouTube. And it's a fairly recent video. So that's integrating the mind and the body, kind of. We also have the Emsculpt, which uses magnetic pulses and radio frequency to tone up the gut muscles and kill, yes, I did say kill fat cells, which are eliminated through the lymphatic system. The problem with some diets is, and GLP-1s, you'll shrink the fat cells, but you won't kill them. So they'll come back if you refeed. This will kill the fat cells, some of them. Visceral fat, the most toxic kind of fat in the body. That's integrating mind and body for peak performance. And the ExoMind. I am particularly happy with the ExoMind. So as you're walking down, the ExoMind display is the first thing that you will see. And this, ladies and gentlemen, is antidepressant therapy with magnetic pulses no meds, no side effects, no downtime. And it has been studied in a number of interesting developments. One is the mental well-being study. They used 4 treatments. People came in and got their brain zapped once a week for 4 weeks and vastly improved mental well-being. In fact, it took care of depression in some of the patients. The study that we headed up here in Evansville was for food craving and impulse control. And patients came to CWI twice a week for 3 weeks. And we measured their food craving and their impulse control on rating scales. And we treated their brains twice a week, 3 weeks, 6 total treatments. And then we looked at where they were when they came in versus after the 6th treatment. And then we looked at them 1 month later. And then we looked at them 3 months later. And there was consistent improvement in impulse control and food craving. Many people, and by the way, they signed an agreement for the study that they would make no changes in their diet or exercise regimen. They promised. Lo and behold, some of them came in and said, well, I was just feeling so good that I decided to start eating healthier. Or I was feeling so good, I decided to start taking my dog out for walks in the morning. Question.
How are you determining the improvement? Is it just because they tell you I feel that or is the blood work done, or is there...
That's an excellent question. Oh dear, I may be out of party favors. Do you have a book yet? Here you go. How do you determine, and I got to be careful because I'm right here in front of that speaker. Thank you. How do you determine the improvement? Is there blood work? No, that wasn't part of the study. The study looked at their rating scales. There was 2 different rating scales that they filled out, and we measured them. We measured the waist and the hips and the weight, and it went down. Now, if I had measured the blood work, what I would have anticipated to have happen is the fasting glucose would have gone down, the hemoglobin A1C would have gone down. Those things I would have expected to see, but the blood work was not done with it. Okay, that's an excellent question. So it's one of the things that we offer. Question? Yes, please.
So can you expand about the oxidase inhibitors, monoamine?
Yes, I can. Can I get back to that in just a second? The question was, can I explain about monoamine oxidase inhibitors? Yes, I will. But I want to finish about the ExoMind. The ExoMind, and I lectured in Hong Kong on this. BTL flew me to Hong Kong to talk to a bunch of people in the Asian area. The ExoMind is basically TMS for the 21st century. So TMS stands for transcranial magnetic stimulation. It is a way to get changes in the brain to treat depression, essentially. And it shoots magnetic pulses right about there. It's the left dorsolateral prefrontal cortex is where it is in the brain. And by shooting magnetic pulses there, it causes current to flow in these neurons, which go down and synapse at deep brain nuclei, which communicate with a network throughout the brain. It causes a pervasive change in the neurotransmitter status, and it also increases something called brain-derived neurotrophic factor, BDNF, which you can think of as miracle grow for your neurons. So how many of you know about miracle grow? Hey, I'm a dude. I even know about miracle grow. So you put it in your plant, and your plant grows better. Okay, that's what brain-derived neurotrophic factor does in the brain, and this increases it. So the old technology, and again, go to YouTube, CWI YouTube, got a lot of stuff there. Years ago, I did a video, this is either 12 or 13 years ago. It's called Dr. Cady Explains TMS. And if you go to Google and type in Dr. Cady Explains TMS, it's the first thing that'll show up because it's got 80,000 plus views last time I checked. So that was the old technology. Again, good news, bad news. The good news is it worked. The bad news is for the first few sessions, it felt like an ice pick going into your head. It was painful, but it worked, and people were willing to deal with it. Other bad news, the FDA labeling was 30 treatments. If you were going to have this done for resistant depression, you were signing up for 30 treatments. And we were charging $300 at the time, so that was $9,000. Thank you very much. And I don't take insurance. And there were people that were so desperate that they paid me that, and they got their money's worth. But it hurt, and it took a long time. So 3,000 pulses is what that machine put out, with a 0.5 Tesla magnetic field strength. The new one, the ExoMind, puts out 6,500 pulses per second. So I'm sorry, 6,500 pulses per treatment with a 3.5 Tesla field strength. So when you total everything up and also look at the actual energy delivered, it's 9 times more powerful treatment for treatment. That's the reason why I can use 2 treatments and get people well. I'm going to specifically mention one of the people that I did that with. Her name is Amy Adams. She is the Wiki radio personality in the morning. I'm telling you this because she's talking about it on the air. It's a joint endeavor for her. Wiki gets some advertising from me, and I get advertising from them. And 2 treatments back to back eliminated her depression. So we've got videos of her on the CWI YouTube channel, and just listen to her on Wiki. She's very entertaining. I highly recommend it. She's got a blog on Wiki. Knock yourself out. Anyway, 2 treatments. It's basically the equivalent, 9, it's the equivalent of 18 previous treatments on a TMS machine. Cost. This lady wants to know how much it's going to cost. I'm going to tell you. What is the cost? Thank you. What is the cost? It is $500 per treatment. Typically, the treatments have been 6 treatments, so that would be $3,000. Because I'm always looking for ways to treat my patients more efficiently and more economically, we do 2 treatments back to back. So the 2 treatments back to back, instead of $500, we do $750 for 2, and 3 treatments, $2,250. And if you need it, we got 25% off here. The 25% off is until Friday of next week. That's the cost. As opposed, and you get it done and you're finished, as opposed to having to keep going back and back and back Monday through Friday, 6 weeks in a row with the old-timey TMS. I need to be wrapping up here in a second. I'm going to answer this question, and then you're next, and you're next. What about monoamine oxidase inhibitors? Okay, what is it? Ma'am?
Does it help does it help to our body?
Does it help our body? Yes, in the sense that if a woman, depression? Yes. Okay, so MAOIs. An MAOI is the thermonuclear bomb of antidepressant therapy. There is no more powerful drug than an MAOI. The problem is it can kill you. It can kill you. If you're on an MAOI and you shoot up nasal spray or pop a Sudafed, it can kill you. Because it has effects on the body as well as the brain. But the natural amount of MAOI effect of estrogen is physiologic. God or nature put it there for a reason. So it helps with depression. Yes, ma'am. And it helps with mental clarity. Does that answer your question? Okay. There was another question over here. Yes, ma'am. Speak up. The question is, with the magnetic therapy, does it have any effect on people with migraines? I would be careful in using it with somebody with migraines, but there have been particular TMS techniques used for people with migraines. But I'm not doing that. There was another question. Yes, sir.
Does it still hurt? Does the new migraine?
Thank you so much. Does it still hurt? No, it doesn't. I have had people ask me, can I go to sleep with this? Is that okay? I mean, it's like a scalp massage. And I know because I had 5 minutes treatment on the old machine because that's as much as I could take because I wanted to feel what my patients are feeling. And then I've had double treatments on this one. It is very good for mental clarity. Yeah, it does not hurt. You do not wear the cap. The cap is a different device. You lie on the table, it takes me 20 seconds to find where I need to zap, and then you're good. Right here. It's if you go by our booth and look at that first thing, you'll see how it's positioned. There's no cap, no cap. Yes, ma'am.
I have to go backward.
Go where you want to.
Well, when you're talking about estrogen,
Yes.
you said now, after 10 years after menopause, do you recommend estrogen?
Oh, thank you. Thank you. Wonderful question. Oh, you're gonna have to come by the booth. I'll give you something. Okay, Farah, this woman gets something. Okay. So the question was, so you said 10 years after menopause, what then? Or I mean, are you screwed? No, you can't take oral, but you can take creams and you can take pellets. And some people, the dissolvable troches underneath the tongue. Okay, so yes, you do not have to suffer, and you can get get your life back.
Would you have to take progesterone also?
If I'm treating you, yes, you have to take the progesterone. There's some people that are just kind of slap happy and don't really pay attention to it if a woman doesn't have a uterus. But yes, if I'm treating you, you have to take the progesterone. Yes, ma'am.
Good question. So, like, when you are testing hormones, what kind of testing are you doing? Blood work? Because
Yeah, okay.
Are not it depends on what you're doing that day, as our hormones change constantly. Like, what's the standard?
She wants to know the ins and outs of the testing. Yes, I'll be happy to tell you that. I test women's hormones on day 12 of their cycle. So that's like you bleed for 5 days, and then the next week is the follicular phase. I'll get you in the follicular phase. And I will check your LH and your FSH to see how your pituitary is stimulating your ovaries. And I will check, so LH and FSH, estradiol, progesterone, free and total testosterone. And then when I'm really working a woman up, I'll do DHEA sulfate. I will check sex hormone binding globulin. I'll also check her blood count, CBC. And if there are any, and typically, if there are weight or blood sugar issues, like for poor Carol, I'll check a fasting comprehensive metabolic panel, a CMP, which gives glucose and hemoglobin A1C and a fasting insulin. That gives me basically everything I need to know. That's a wonderful question. I've got 1 minute left. Yes. Does my testing change if you don't have a period based on birth control? Kind of. I won't be checking estradiol and progesterone because your birth control is going to mess it up. It will basically make it look like you're in menopause. You'll have no estradiol, no progesterone, which, by the way, is dangerous for your bones because it ain't the fake synthetic estrogen that's going to keep your bones healthy. It's going to be the estradiol. But I certainly will check testosterone. And that's one of the ironic things is when women are on oral contraceptives to keep them from getting pregnant, and you know how people get pregnant, right? The ironic thing is having sex is sometimes the last thing on a woman's mind on oral contraceptives because they feed back on the pituitary stops secreting LH and FSH, and then you don't have testosterone because the ovaries aren't getting stimulated. So your testosterone level plummets. So I'd for sure be checking that. It's still fake hormones. Still fake hormones. Yep.
Where's your clinic here in Evansville?
Ma'am,
Where's your clinic here in Evansville?
come by the booth. They'll be happy to get. Okay, I'm getting the wave now. Let me tell you, I love what I do. I don't have to go home until like 11 o'clock tonight when my wife would expect me home. So I want to get out of the way for the next person and I will go right back there or at our booth, and you can keep grilling me with questions until everybody gets their questions answered. So thank you all for being here. I really appreciate it. Thank you.